Hi guys, Dr. Brodsky here. Welcome to your first trimester. This includes the 4th week of gestation up through the 12th week of gestation. So this is the most tough period of time where you're going to feel the most tired, but it's also the most exciting because you're going to just found out you were pregnant and have a positive pregnancy test. Things that you may be experiencing during the first trimester are feeling extremely fatigued, like you can never get enough sleep. This is very common in pregnancy, especially in the first trimester. Hang in there, it gets better, and this is very common and very normal. So listen to your body, make sure you rest, and give your body the naps it needs. The other things you might start to notice in the first trimester are you start having some breast tenderness. This is when the nausea and some of the vomiting begins. So hopefully you don't feel any vomiting, but if you feel sick to your stomach and you're nauseated, sometimes eating smaller, more frequent meals can help. Over the counter, there's products that contain ginger or vitamin B6, and those can be helpful. But talk to your doctor if it's severe, and there are some prescriptions that are available. Other things people notice are that they're constipated, they may find that they're dehydrated at times, they may have bloating, and they may have more urinary frequency too as that uterus is growing. So a little bit of mild cramping can be normal, but you should never have vaginal bleeding or severe cramping. If so, definitely call your doctor and make sure that gets addressed right away. Things that you can expect to happen at the doctor during this first trimester are just to lay out common pregnancy question and blueprint answers for you for the rest of the visits. So what I usually go over at the first visit with a patient around 6 to 8 weeks is establishing their due date by doing an ultrasound, and this is most accurate in the first trimester. So if you're questioning when to get prenatal care, get it as soon as you can in the first trimester. We can see the baby on the ultrasound with a heartbeat around 6 to 8 weeks, so that's when we really like to establish a due date for a patient. So keep that in mind when you're making your appointment. Also, when you meet your doctor, they're probably going to do a set of labs at your first visit. These are very common and typical. Basic new OB labs include checking your blood type, checking an antibody screen, checking your blood count, hepatitis B test, syphilis test, and a urine culture to make sure you don't have a bladder infection. HIV testing is also recommended. Your doctor is also going to talk over with you about some carrier screening. For example, this depends on your family history and if there's any increased risk factors for carrying other genetic problems in your history. But basically, we usually just test for a cystic fibrosis gene and make sure that you couldn't pass that on to your baby. So that's something your doctor will discuss with you. The other thing your doctor will do, usually at the first visit, is do a pap smear if you haven't had one recently, and also double check that you don't have gonorrhea or chlamydia. That's just a very common thing that can be overlooked and sometimes underdiagnosed, and so we tend to do that most commonly at the first prenatal visit to make sure everything's okay. Another thing in the first trimester to discuss with your doctor is genetic screening. So this is completely optional for all patients of all ages. Some people completely decline screening, and by screening it means non-invasive. So it's either ultrasounds or blood work from you and nothing harmful to the baby at all. And it's just informational. So some people choose to get screening because it helps them feel more prepared or more reassured, but other people opt out of it when they consider the risks and the benefits. So talk about that with your doctor so you can see exactly what screening options are available. But even as early as 9 or 10 weeks, you could potentially get some of that done. Another thing your doctor will talk over with you is that they'll probably see you every 4 weeks until you're 28 weeks, and then it's every 2 weeks. At the end, it's going to be weekly. So as long as you're a low-risk, healthy patient, it's a good thing to go for a month without seeing your doctor. That's okay, and you just have to know what to look out for and know when to call. So the other things that you should be doing right now are making sure you're taking a prenatal vitamin every single day. You can also add the DHA supplement to it, which is a specific type of fish oil that can be helpful for a baby's brain development. The other thing you want to do is pay attention to what you're eating. Small, frequent meals tend to sit more easily in pregnancy than large meals. So that's why you get constipated and acid reflux, is because your digestion is slow. So eat smaller meals more often, every 2 or 3 hours, to ward off nausea and obviously help with digestion. Things that you cannot eat when you're pregnant are raw fish, unpasteurized cheese, and if you have deli meat, just make sure it is steamed before you eat it, and that's most safe and what we recommend. So get a heated sandwich. If you're out somewhere, just have them toast it. So the other thing to mention about your diet is that you need an extra 300 calories a day when you're pregnant. So that's not eating for two, it's half a sandwich and a glass of milk at the most. So you don't have to necessarily increase your calorie intake by a ton, but you definitely need a little more than usual when you're pregnant. Mostly for drinking, you want to drink water, 64 ounces a day, which is a gallon of water. So get a cute little cup, carry it around with you, and drink 8-ounce glasses or whatever you want to do to get to your 64 ounces a day. Your water requirement is going to go up in pregnancy. The other thing that a lot of people don't realize is that caffeine has been studied, and a low amount in pregnancy is proven to be safe. So you can have up to 200 milligrams a day of caffeine and still be okay. So you don't have to totally give up that cup of coffee unless it gives you acid reflux like it did me, which was so sad. So then I caught back up in the second trimester. So the other things to look out for right now are, of course, any vaginal bleeding, any severe cramping, if you have severe nausea and vomiting, a fever, chills, or you have any questions for your doctor, feel free to call them and let them know if any of those symptoms come up. So that's it for your first trimester. Thank you so much for watching this video. You can also check out my monthly and weekly pregnancy videos as well, and you can also find me on drbrodsky.com.